Hello everyone. So today we'll start with our topic limb length and limb girth measurement. So limb length and limb girth measurement comes under the anthropometric measurements. So what is anthropometric measurement? The anthropometric measurement means it is the study of measurement of human body in terms of the dimensions of the bone, muscles and adipose tissue. So it is a systematic measurement of the physical properties of a human body where we take the data of the length and breadth of the body parts and record it for our clinical practices as well as for research. So it plays an essential role in clinical practice and research where we evaluate and record the variables of the human body and physical conditions of each individual or patients. So for us to efficiently record the findings or the data from our anthropometric measurements, we need to have a high quality anthropometric instruments with which we will be measuring various parts of the body as well as thorough knowledge of the anatomical landmarks where we will be placing the measurement tools for recording and measurements. We as a physical therapist also should be highly skilled to use and observe the measurements. There should be a sufficient experience in using the established measurement procedures, and we should be revising the validity and reliability of the equipments or measuring tools. So these are some of the criteria or principles we need to follow for measurements of the human body of the patient. So what are the measurements that we can take? What can be measured by using anthropometric tools? We can measure the limb length, which is very important for us physical therapists, so that we can see the alteration or differences in the patient's body parts or the limb. Another measurement that we can take is for edema and localized swelling. So it can be in any part of the body. Edema means there is a fluid collection in the tissues or around the tissues, and localized swelling could be because of inflammation or any kind of other conditions. Another measurement that we can take is for joint. Commonly, the joint goes for enlargement because of the joint effusion, that is, the collection of fluid in the joint spaces. For example, the swelling caused by the excessive fluid that is accumulated inside the knee joint space, so due to which the knee one side or the inflamed knee will look larger than the other knee. Other measurements we can take is for muscular changes. So the muscles will go for hypertrophy or atrophy. So hypertrophy means enlargement in the muscle bulk or muscle belly, whereas atrophy means reduction in the muscle belly or muscle fibers. The differences of muscle growth or muscle loss can be measured by anthropometric measurements. Outcome of these surgical procedures also can be recorded by using these tools. For example, if the patient had undergone a hip surgery, or you can see in the picture here the internal fixation of the femur because of the femur fracture. Now, because of this condition, the fractured limb or the fractured bone could increase in size compared to the normal side or decrease in size. This can be recorded measuring the limb length. Next is skin fold thickness also can be measured by using this measurement tools. So skin fold thickness is mainly used to track the progress during weight loss programs. So coming to measurement tools. So what are the few measurement tools that we can discuss here for anthropometric measurements? First one is called as stadiometer. The stadiometer is used mainly for measurement of the height. So it is used in clinical evaluation, especially after, for example, vertebral fracture. So post vertebral fracture, we can measure whether there is any reduction or there is a increase in the height. Another type of instrument that can be used is a soft metric tape, or also called as measuring tape. So this is a very simple tool, very easily available. So this is mainly used to measure the length and girth of the limbs or any body part. So skin fold caliper is the tool which is used for measuring the skin fold thickness. So if we want to estimate the total amount of body fat, four skin folds should be measured. Number one, the bicep skin fold, which can be measured in the middle part of the upper arm. Next one is the tricep skin fold, which can be taken at the back side of the middle upper arm, and the subscapular skin fold, which is under the lowest point of the shoulder blade or the inferior angle of the scapula. The fourth one is the suprailiac skin fold, that is on the iliac crest, just above the iliac crest or upper bone of the hip. So if we take these four skin fold measurements, we can estimate the total amount of the body fat. Next type of instrument is called as sliding calipers. This is designed to determine the dimensions of the head or the nasal height or width. It also can be used to measure the distance between the inner and outer eye corners. It can be used to measure the lower jaw height, hand width or foot width, etc. Thoracometer is also one type of sliding caliper which can be used to measure the length of the foot or width of the foot. This device consists of an aluminum square section rod fitted on both sides with a millimeter scale measuring from 0 to 400 millimeter. The other caliper is called as spreading caliper. This is mainly used to measure the head circumference. The last one which we'll discuss here is the volumeter. The volumeter is designed to objectively measure volume of the body part by using the fluid displacement method. As you can see here in the picture, the limb is immersed inside the volumeter, because of which some amount of fluid will be coming out of this volumeter inside the jar. So this fluid can be measured to record the limb girth. Now we'll be thoroughly discussing how we can measure the limb length of the lower limb. So before understanding how to measure the lower limb length, we have to understand first the limb length discrepancy. So what is limb length discrepancy? It is also called as anisomelia. The limb length discrepancy is a condition in which commonly the paired lower extremity limbs have a noticeably unequal length. So you can see in the picture here, one limb is shorter than the other limb. So there is a significant limb length discrepancy here. So if a physician finds that there is more than 1.5 to 2 centimeter of difference between two limbs, then it is recommended for further evaluation and also advice for the correction of this limb length discrepancy. And in most cases, the bones that are affected by limb length discrepancy are the femur, that is the thigh bone, and the tibia, which is the shin bone. Now let us classify this limb length discrepancy into true limb length discrepancy and functional limb length discrepancy. So what do we mean by true limb length discrepancies? So if there is an actual bony asymmetry, then we will call it as true limb length discrepancy. For example, if the femur of one side is shorter than the femur of the other side, it is called as true limb length discrepancy because there is a difference in the length of the bone. Or other example could be the length of the tibia on one side is longer or shorter than the length of the tibia of the other side. Some of the causes for true limb length discrepancies could be previous injury to the bone, for example, fracture of the bone. So after fracture, if the bone heals in a certain position, then it can cause limb length discrepancy. If there is any trauma to the epiphyseal end plate prior to skeletal maturity, it also can cause abnormal growth on one side, causing limb length discrepancy. Any bone infection could be the cause for limb length discrepancy, or any kind of bone diseases and malignancies. And one of the most common and important cause for true limb length discrepancy is arthroplasty. So arthroplasty means the replacement of the joint by artificial substance. As you can see in the picture here, the hip joint has been replaced by artificial substance, and it is called as hip arthroplasty. Next type of limb length discrepancy is functional limb length discrepancy. So as the name suggests, it is not because of the shortening of the bone, but it is because of the shortening of the soft tissues, or because of the stiffness of the joints and contractures of the joints. It also could be because of the ligamentous laxity. It could be because of the malalignment of the bones or the structures. For example, here you can see in the picture there is a scoliosis, and also there is a lateral tilting of the pelvis or lateral bending of the pelvis. These are some of the axial malalignments which can cause limb length discrepancies. Low back pain, scoliosis are some of the malalignments. Scoliosis means there is a lateral shift of the spine or the vertebral column, because of which there will be lateral tilting of the pelvis bone, causing one side of the hip joint to raise upward and the other side of the hip joint to be depressed downward, because of which one side of the lower limb will be looking longer than the other side. Another cause for functional limb length discrepancy could be altered foot biomechanics, such as excessive ankle pronation. So these were some of the causes for functional limb length discrepancies and true limb length discrepancies. So I hope you understood clearly what are the causes for functional limb length discrepancy and true limb length discrepancies. So true limb length discrepancy means there will be alteration in the bone or the structure of the bone. For example, simple example is fracture of the bone. After fracture, the bone may heal in a shortened position or a lengthened position, due to which there may be limb length discrepancy. Whereas in functional limb length discrepancies, the cause for the shortening of the lower limb is not because of the bone fracture, but it is because of the shortening of soft tissues, for example, muscles. You can take example as an adductor muscle. If it goes for tightness on one side, it may cause more adduction of the hip joint on one side, causing the pelvis to tilt on the other side, due to which there will be limb length discrepancy. So in today's lecture we have discussed about the anthropometric measurements, where we have discussed few tools, what are the measurements that can be measured, and also we have discussed the type of limb length discrepancies. So I would like you all to fill up the it is mandatory for everyone to fill up the assignments which I'll be sharing through Teams. Attendance will be given based on the assignments which will be submitted within the time frame. If you are unable to submit the assignments within the time frame, I will not be able to give attendance for that particular student. So if there is any questions from this lecture, you may contact me through Teams or through WhatsApp. Thank you. Hello everyone, welcome back to exercise therapy class. We were discussing limb length and limb girth measurement. So last class we discussed what is anthropometric measurements, what are the principles of anthropometric measurements, what can be measured by anthropometry. We can measure the limb length and limb girth spatially, and also we can see the changes at the muscular level. We also can see the asymmetry of the body parts, and also can see the outcome of the surgical procedures. So some of the measurement tools that we discussed in last class were stadiometer, which is used for measurement of the height; softmetric tape, which is specially used for measurement of the length and girth of the limbs; skin fold calipers as well as sliding calipers also were discussed, and one of these sliding caliper is also called as thoracometer, which is used for measurement of the foot length or girth. We learned about the spreading calipers, which is mostly used for measurement of the head circumference, and we discussed about the volumeter, which is primarily used for girth measurement. So last class we discussed what is limb length discrepancies. It is also called as anisomelia, and the limb length discrepancies can occur because of true limb length discrepancy or functional limb length discrepancies. Some of the causes for true limb length discrepancies: injury to the bone directly. Either the bone will be shortened, or because of the fracture, or because of the bone diseases or malignancies, etc., or replacement of the joints. Next was functional limb length discrepancies. It is not because of the shortening or lengthening of the bones, but it is because of the shortening of the soft tissues, because of the axial malalignments, for example, scoliosis or excessive ankle pronation, etc. Now let's move on to methods of measuring limb length. So what are the types of methods that can be used to measure the limb length? Primarily, two types of methods are used. Number A, true limb length measurement, and number B, apparent limb length measurement. As you can see in the picture here, the true limb length measurement is taken from the anterior superior iliac spine to the medial malleolus, whereas the apparent limb length measurement is taken from the umbilicus to the medial malleolus. So this is the basic difference between the true limb length measurement and apparent limb length measurement. Let's discuss some of the general procedures or principles before using these techniques. First of all, before using these techniques, we need to introduce ourselves to the patient, and also we should take the consent from the patient for conducting the measurement on their body. To get the consent, we need to explain to the patient about the measurement techniques which we are going to use. Patient needs to be adequately exposed, or the part which is being measured should be adequately exposed. Therefore, the consent or the permission from the patient should be taken. And when we are examining the female patient, we should make sure that there should be a female nurse or assistant around the examination area, so that the female patient feels comfortable. While examining the child, it's best to keep the parents beside them so that they feel comfortable, as well as it is ethical to keep the parents beside the child. So, all the procedures should be explained to the patient. First, we will examine the asymptomatic side rather than the symptomatic side. The measurement should be taken by the softmetric tape, and it should be taken in centimeters. First, we need to place the tape flat on the body so that the readings are visible to the examiner. The tape measure should be stretched properly to get a correct reading. If the tape is slack, then it may generate an incorrect reading. So these are some of the general procedures which we need to remember and follow. So the first technique is the apparent limb length measurement. For this, the patient has to be in supine lying position, that is, patient lying on their back. The landmarks that is required for measuring apparent limb length measurement are the umbilicus and the medial malleolus. The one end of the measuring tape has to be placed on the umbilicus by thumb, and the other end should be placed on the medial malleolus. So this is a easy method. We have to just take the measurement from the umbilicus to the medial malleolus of one limb and compare it with the other limb and see the difference. To make sure that the ASIs are aligned in position, we have to keep 2 feet apart, that is about 15 to 20 centimeter, and it should be parallel to each other. So let's check the video demonstration for this apparent limb length measurement. Next one is the true limb length measurement. For this, patient has to be in supine lying position and squaring of the pelvis has to be done. So what is squaring of pelvis? The squaring of pelvis means the ASIS, that is anterior superior iliac spine of left and the right pelvis, has to be aligned properly. So to check if ASIS is aligned properly, we have to measure the distance of ASIS from the greater trochanter of the femur and ASIS from the umbilicus. So if the distance is not equal, that is if the left ASIS is not in equal distance as compared to the right ASIS with reference to greater trochanter and the umbilicus, then we have to move the leg to adjust the ASIs in a same level. So we can visualize the video demonstration how squaring of the pelvis is done and also the measurement using true limb length measurement. So for true limb length measurement, we have to measure from the anterior superior iliac spine to the medial malleolus using a inch tape or soft metric tape. Next type of measurement technique is also called as segmental location of difference or segmental measurements. So this is not as commonly used as apparent and true limb length measurement, but this also is a valid technique of measurement. So segmental measurement means the segments of the lower limb will be measured. So first segmental distance that is to be measured is from the anterior superior iliac spine, the ASIS, to the greater trochanter. So we'll record this distance and compare with the opposite side. Second segmental distance to be measured is from the greater trochanter to the lateral joint line of the knee. So this distance will be the second segment which will be measured. The third segment is from the medial joint line of the knee to the medial malleolus. In this way, we can measure the segments of the lower limb and see where the shortening or lengthening has occurred. So first from ASIS to GT, we can predict the length problem at the neck of the femur or in the pelvis bone. Whereas in second segmental measurement, we will see the length of the femur bone and compare with the opposite side. In the third segmental measurement, we will be comparing the length of the tibia with the opposite side. So before taking the limb length measurement, we can perform the test to see if there is a shortening. This test is called as Gallagher test. So in Gallagher test, we'll ask the patient to flex the hip to 45 degree and knee to 90 degree. If we see there is a shorter limb, then we can predict there is a shortening of the tibia bone. And if one limb is forward to the other limb, then we can predict either the femur is short or femur is long. So these are some of the limb length measurement techniques. So first technique was the apparent limb length measurement, which is measured from the umbilicus to the medial malleolus. Second measurement technique is from the ASIS to the medial malleolus, that is called as true limb length measurement. For that we need to square the pelvis first. So what do you mean by squaring of the pelvis? We need to check the alignment of the ASIS with each other. For that, we need to measure the distance of ASIS from the umbilicus and from the greater trochanter of the femur. Then we discussed about the segmental measurement, where first segment we are going to measure is from the ASIS to the greater trochanter, and second segment is from greater trochanter to the lateral joint line of the knee, and third segmental measurement is from the medial joint line of the knee to the medial malleolus. And here we have discussed about the Galeazzi test, where we'll ask the patient to flex the hip to 45 degree and knee to 90 degree. And then we'll see if there is a abnormal shortening or lengthening of the tibia or femur. Let us move on to limb girth measurements. So what do you mean by limb girth measurement? It is self-explanatory. Girth measurements are measures of circumference of the body part taken at specific anatomical sites of the body using a soft metric tape. So some of the procedures we need to follow for taking girth measurement, and the most important is to remove the clothings. If you are measuring with clothes on, then there will be inaccurate reading of the girth measurement of the limbs. The measurement should be perpendicular to the skin surface so that we can get the appropriate or accurate measurement, and also it should be perpendicular to the bone of the body segment. We also should remember that while placing the inch tape, we should not depress the skin too much so that it gives us inaccurate readings. Each measurement of the girth should be taken at least 2 times for accuracy. The first measurement, let's discuss about the arm girth measurement. What are the reference point for arm girth measurement? The first reference point is the acromion process, and the second measurement point is the lateral epicondyle of the humerus. The measurement is taken at the midpoint between the acromion and the lateral epicondyle. So you can see here the therapist places first point at the lateral epicondyle and second point at the acromion process. Then he takes the midpoint of this reference points and then measures the circumference of the arm. For measuring the forearm girth, the measurement is taken along the forearm at the point of the largest circumference. So the largest circumference of the forearm is mostly found closer to the elbow. If we are not confident with the largest point of the forearm, we can take 3 measurements near the elbow and then take the largest measurement as our girth measurement of the forearm. Wrist girth measurement is taken as a figure of 8 measurement. What are the steps for wrist girth measurement? The medial aspect of the wrist just distal to the ulnar styloid process is used as the starting position. So this ulnar styloid process is taken as the starting position. Second step is to cross the inch tape or the measurement tape across the wrist joint and reach the radial styloid process from the anterior aspect of the wrist. Then in third step we will cross the measurement tape across the hand and reach the fifth metacarpophalangeal joint. Then from here we will cross through the ventral surface of the hand, that is anterior surface of the hand, and reach the second metacarpophalangeal joint. Then the measurement tape is brought across the dorsum of the hand to the starting position. So you can see here it gives a figure of 8 structure while measuring this wrist girth measurement. Therefore the name is called as figure of 8 wrist girth measurement. Let's see the video demonstration. First starting position is the styloid process of the ulna. Then the inch tape is taken towards the styloid process of the radius. From here the inch tape will be crossed across the hand and reach the fifth metacarpophalangeal joint. So from fifth metacarpophalangeal joint The instep is crossed across the hand and reach the second metacarpophalangeal joint. From second metacarpophalangeal joint, the instep is taken to the starting position, that is the styloid process of the ulna. So this is the measurement technique for wrist and hand, and it is called as figure of 8 measurement technique. This is mostly used to see the edema over the hand and the wrist. Next, coming to ankle girth measurement, which is also similar to wrist girth measurement. Here too we use the figure of 8 technique. So what are the steps to measure ankle girth measurement? First, the measuring tape has to be placed midway between the tendon of the tibialis anterior and the lateral malleolus. Then the tape is pulled medially towards the tuberosity of the navicular bone. From there it is crossed across the arch of the foot, and the measuring tape reaches the fifth metatarsal or the base of the fifth metatarsal bone. From fifth metatarsal, the instep is brought towards the tibialis anterior tendon. It crosses the tibialis anterior tendon and reaches the distal part of the medial malleolus. From medial malleolus, the instep is crossed across the Achilles tendon, circling around the ankle, and it reaches the starting position, that is midpoint between the lateral malleolus and the tibialis anterior muscle. So let's see the video demonstration. So you can see here the starting position is midway between the lateral malleolus and the tibialis anterior tendon. Then the instep is taken towards the medial aspect of the foot, crossing the navicular bone. From there, the instep is crossed across the arch of the foot and reach the fifth metatarsal or the base of the fifth metatarsal. From there, the instep is brought towards the anterior aspect of the ankle and cross over the tibialis anterior as well as the distal aspect of the medial malleolus. Then it crosses over the Achilles tendon and over the lateral malleolus and come to the starting position. So this is the technique to measure the limb girth or the ankle girth measurement by figure of 8 technique. Next is the calf girth measurement technique. So for calf girth, the subject has to stand erect with their weights evenly distributed between both feet. The measurement is taken at the level of the largest circumference of the calf. Next is the thigh girth measurement. For thigh girth measurement, the subject has to stand erect with their weight evenly distributed between both feet. Then the midway or the midpoint is taken between the greater trochanter of femur bone and the lateral condyle of the tibia. So you can visualize here the instep is placed at the greater trochanter and at the lateral condyle of the tibia. Then the midpoint is taken between these two reference points and the girth is measured. Next is gluteal girth measurement. So gluteal girth measurement is taken at the level where the gluteal muscle protrudes the most. The subject has to stand erect with their weights evenly distributed between both the feet, and we have to make sure the recording has to be perpendicular to the spine and also it should be flat on the skin surface. So you can see in the video here the instep is placed at the level where the gluteal muscle protrudes the most, and then the measurement is taken. And we have to make sure that the tape is lying flat on the surface as well as it has to be perpendicular to the spine. Next measurement is for trunk measurement, and the first one we are going to observe here is for waist girth measurement. So the waist measurement is taken at the narrowest waist level, and it should be taken after the patient performs the full inhalation and exhalation. So the measurement should be taken after full exhalation. Now, if we are unsure that this measurement was taken at the narrowest level, several measurements has to be taken at different levels. So one can be just above the narrowest level, one at the narrowest level of the waist, and third we can take just below the narrowest level or at the level of the umbilicus. When recording, we have to make sure that the tape is lying flat on the skin surface and it has to be parallel to the ground and perpendicular to the spine. The last measurement technique is for the chest girth measurement. So it is taken at the level to the mid of the sternum with the tape passing under the arms. Then we'll ask the patient to inhale and fully exhale. So after the patient completes a normal exhalation, we will take the measurement. So when recording, we have to make sure the tape is lying flat on the skin and horizontal to the ground and perpendicular to the spine. So these were some of the girth measurement techniques which we have discussed today. First one was for the arm measurement, second one was for the forearm measurement, third was for the wrist girth measurement, fourth was for ankle girth measurement. Wrist and ankle girth measurement is measured by figure of 8 technique. Then calf, thigh and gluteal area measurement also can be taken with the inch tape. Then for trunk measurement, we can take the waist measurement and the chest girth measurement. So we have completed the theoretical theory for limb girth and limb length measurement. Next, we will be moving on to practical demonstrations and practice for limb girth and limb length measurement by the students, for which I will be sharing a video demonstration of all the measurement techniques, and when the practical classes are assigned, we will be practicing those techniques as well as perform the demonstrations. Thank you.